All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. This show is for our European and Asian cool beans. And I am still figuring out the time that is right for me and for the cool beans. So today I try to do it a little earlier and see what happens. This allows me a bigger chunk of time during the day that I can do my other business affairs. So with this, tell me in the comments if you like this time better than 11 as we did yesterday, or that time was better, and so I'll continue to adjust. With this, let's start our discussion today. The important discussion was about AstraZeneca once more. Somebody had pointed out, actually, one of the cool beans pointed out yesterday that I skipped some paragraphs from EMA, and they thought that somehow I was being I felt that the interpretation was that somehow I'm intentionally not showing the other paragraphs. I actually scrolled those things on the screen, plus I put the links in the descriptions as well for folks to go and read them. It is kind of not necessary for me to spoon feed every single word. However, yesterday's avoiding that second paragraph was actually, I wanted to, and let me explain why. So I'm going to go back to AstraZeneca. First news that I want to share with you is that AstraZeneca was stopped in 20 countries after the reports of thrombosis or blood clotting. And since this Friday, I believe, the last Friday, majority of them, about 10 or 11 countries, and maybe by now even more, have said that they are resuming the vaccination, because European Medicine Agency came back and they said, we do not see a reason that the vaccination should be stopped based on this report, and they have done their research. So the punchline, the bottom line today is that the AstraZeneca is found to be safe, and those concerns are not that valid. And so you should be comfortable that it is fine. Now let's look at what EMA said in more detail, as some folks are pointing out that I avoided them. And I'll explain why I avoided saying some of the things, because there was a double speak in there, and I had to kind of either explain it or avoid it. So I'm going to explain it today. What is the double speak in there? So let's do it. I hope everybody is doing good. I hope this time works for majority of the folks in Europe and Asia. And let's look at AstraZeneca's situation. So this is drbeen.com. Here, a couple of good articles in Science. This is an article in Science that was, what is the date here? March 17, where they had described the 20 European countries that had temporarily paused. They don't use the word stopped. They use the word paused to for the thrombosis reports. Then here is another article. This is March 18, the next day. And here, this is important that EMA officials have provided their message, and I'm going to go over that a little bit more detail and explain why they say on one end that there is no association, and they also kind of cover themselves as well by saying there may be association. So that is a double speak, and we'll look into that. But generally, once again, AstraZeneca is safe from this thrombotic events. At least that is what EMA is saying. So here, more than 20 countries stopped vaccination. Again, I would have put the word pause because that's what they said. Stopped vaccination earlier this week following reports of mostly young patients who suffered severe clotting disorders and rare types of strokes shortly after receiving the AstraZeneca vaccine. Today, within hours of EMA's statement, Germany, France, Italy, Spain, and the Netherlands, and at least 7 other countries said they will restart vaccination as early as Friday. So this is the discussion. So 18th is when they said, and then by Friday they may have started. With this, now I'm going to go over this, and the cool beans who thought that I was trying to not show the positive news. I'm gonna explain why I avoided it, and we'll go over this as well. So here is what is happening. So check this out. As you can see, And if you wanted to just read it by yourself and just make up your own opinion, totally fine. Here is the link in the description as well. I have never tried to spoon feed you one way or the other, but I think it has become necessary for me to kind of show this. Here, let's look at EMA's safety statement. They're saying the benefits of the vaccine in combating the still widespread threat of COVID-19, which itself results in clotting problems and may be fatal, continue to outweigh the risk of side effects. So I hope it is clear. What they're saying is, fine, if you would not get the vaccine, then it is possible that you can get COVID, and that itself also causes hypercoagulability or clotting, and that can kill as well. So correct. And this is also correct that the wild type infection can actually cause more percentage of hospitalizations and deaths. So they are correct here. They are reminding that, yeah, there is a risk here, but there is a greater risk on the other side as well. Fine, understood. Then they're saying the vaccine is not associated with an increase in the overall risk of blood clots. So please keep this in mind, is not associated with an increased risk of in the overall. So they've used this word overall, and I'll explain that why this word overall matters. In risk of blood clots, thromboembolic events to those who receive it. So let me very quickly draw this out as well for us. So what they're saying is this. So let's say this is a blood vessel. In the blood vessels, we have endothelial cells that are coating the walls of the blood vessels, correct? And these endothelial cells are very, very important because they are kind of slippery and slimy, and they allow the blood cells to zip past this area and run correctly without getting stuck to them. So imagine that this is a slippery surface that is made by these endothelial cells. Now, important thing is the platelets. So sometimes what can happen is, and this is what happens with COVID as well, sometimes what happens is that these endothelial cells end up getting damaged. In case of COVID, we know that ACE2 and ACE1 imbalance causes pro-inflammatory outcome that causes damage to this cell, which then causes the underlying tissue to become exposed here to factor 8, which causes factor 8 to bind with this, which then causes platelets to bind here, and which then causes the thrombosis to start. And we have done this discussion in detail many times in the past. The takeaway here is COVID can cause blood vessel damage, which would then result in the thrombosis. Now the question is, can that be done by a vaccine as well? So again, keep in mind that they are saying there is no overall higher risk. But if we look at the mechanism will be that, let's say we have an antibody generated because of the vaccine, or antibody generated because of something else. So here is an antibody that is binding to the tissue here, and that binding of the antibody to the tissue can cause complement activation, or simply whenever an antibody binds somewhere, it is a signal to our immune system to say, hey, look, I have been bound here. There is a problem here. I'm bound here for some reason. There is something wrong here. This is a bacteria or a pathogen or a virus or a fungus or something that is not right, or a cancer cell. So if I am bound here, destroy this thing. So what happens is complement system gets activated, that tries to kill the cells or whatever pathogen, virus, bacteria, whatever that thing is. And this is one of the mechanisms by which antibody complexes or antibodies directly attaching to the tissue can cause issue. And when I say complexes, this is also possible that an antibody is attached to something else, let's say maybe a platelet or some other antigen, and this complex tumbles and then gets settled here. So again, in case of AstraZeneca, we don't know what is the cause. Or maybe this is just generally thrombosis that is happening. And in those people, something like this, one or two of such events are happening. And they're happening by the vaccine or not, doesn't matter. This is happening. So look at it. What we're talking about is that the thrombosis or clotting occurring in general population, not vaccinated population, and the clotting occurring in vaccinated population being equal means it is just normal mechanisms. And those normal mechanisms can be antibody complexes settling here, that can be antibodies against the endothelial cells, that can be pro-inflammatory, anti-inflammatory mismatch, that could be atherosclerosis, that could be cholesterol, there could be tons of things, that could be other pathogens and so on. The takeaway, the summary again, is there is some damage here, which then causes the platelets to start aggregating in that area, which causes the thrombus formation. If they break away, these thrombi, if they break away, they are now called emboli. These emboli can then go down into the system further down, and then they can get lodged into blood vessels that may not be as big. And now they are stuck here. And when these thrombi are stuck, emboli are stuck here, then the online blood vessel, wherever it is providing the blood supply, that tissue is going to now die. This tissue is going to die. So either it will become ischemic, that means less nutrition and oxygen, or it would become necrose, that means it is dead. This is the kind of phenomena that can occur. So now if we go back here, they're saying the vaccine is not associated with an increase in the overall risk of blood clots or thromboembolic events. So making of this thing is called thrombus. And then when a piece breaks off and goes out, this is called embolism. So thromboembolism, they're saying not much. There is no evidence of a problem related to specific batches of the vaccine or to a particular manufacturing site. So they're saying this is sort of a rumor that some people are saying this batch may be wrong. But the thing is this, there were some countries that stopped a specific batch. So they're saying we did not find a batch to be bad or manufacturing facility to be bad. Okay, fine. Next, however, so check this, however, the vaccine may be associated with very rare cases of blood clots associated with thrombocytopenia. Okay, so now take this, however, and take this statement and kind of put them together. The vaccine is not associated with an increase in the overall risk of blood clots. See, this is why the word overall over here is important. Because there is something there, they are acknowledging. However, the vaccine may be associated with very rare cases of blood clots associated with thrombocytopenia. What does that mean, thrombocytopenia? Look, here is what happens. The thrombi are platelets. Platelets are anucleated small cells. These cells are made from megakaryocytes in the bone marrow, and then they are just running around, these little tiny platelets, having fun. They look like tiny plates. Their function is to start clotting the blood. So what they're saying is that the thrombocytopenia may be possible. And what does that mean? Look, when thrombi are running around in the blood and they start becoming trapped in thrombus formation. So did I call them thrombi? They are platelet. The platelets that are running around in the blood, when they get stuck to the, let's say, the blood vessels, and they start making thrombi, their number would start becoming less in the blood. Why? Because they are being used up to make thrombi. These thrombi would give rise to emboli as well, and then there are clinical outcomes. But what we are talking about right now is consumption, use up of these platelets to make thrombi. This would only happen if there is a lot of thrombus formation in the blood vessel or disseminated intravascular coagulation, disseminated throughout in more than one blood vessels, intravascular within the blood vessels, coagulation or clotting. That is why thrombocytopenia would occur. Penia usually means reduction in number. Leukopenia, reduction in white blood cells. Thrombocytopenia. So that means the number of platelets are reduced. Now, the problem is, why are we talking about that? The problem is that when thrombi thrombocytes number reduce, then further bleeding cannot be stopped. And why is that necessary? Do we bleed and we need now thrombocytes to be there? Yes, sometimes we get infections and we get cuts and injuries and we do bleed and we need thrombocytes to come and make plugs there and stop it. That is one. But what happens in a person who's healthy and normal and may have some clotting going on? Do they bleed as well? Yes. So here is what happens. Our blood vessels, I'm just going to show you one mechanism. Our blood vessels, they repeatedly branch off. That is a common behavior of the blood vessels, that they make branches. These branches then go and they supply various parts of the tissue by branching and dividing. So the biggest blood vessel that comes out of the heart is aorta. Aorta is the biggest, largest one blood vessel. Imagine, let's say, just being flexible, it is a continuation of the heart chambers into one big blood vessel. But then that starts giving branches, and every time it gives branches, it becomes smaller and smaller and smaller until it becomes those small, tiny capillaries everywhere in the tissues. Why am I talking about that? What happens is, at the branching points, at the division points, the blood flow becomes disrupted. So imagine if this was the blood flow, we call it laminar blood flow. Laminar blood flow is like blood is flowing in a laminar way, in a striped way, in a very regular fashion. Laminar blood flow, when this lamina of blood hits a branch point, it turns around. Just like rivers, if you have a stone in the river, around that stone, you would see that there are not blood, there are water, there is water disruption. The flow of the water is disrupted, and there are these waves that are formed. So similarly here, there are waves that are formed at the branch points. These are called Bernoullis. So those folks who know hydrostatic and water or liquid things engineering, they know Bernoulli points, right? Or Bernoullis. So these are the waves that are formed here. These waves in turn cause local damage, and that damage and disruption of the blood itself can cause small pockets of little thrombi formation. These then can cause tiny bit of a thrombi formation or hemorrhages and stuff like that, very tiny, and they are immediately repaired. So our blood vessels internally have a capability. Then any trauma, for example, if I do this, or if I take my skin and kind of do this to the skin, nothing happened here. But inside, there is definitely some trauma that occurred. There are some tiny blood vessels that did rupture, but they would very quickly be repaired by clots and we'll be okay. Now, when the clotting system, the raw material to make clots is thrombocytes. When thrombocytes are less because they're already consumed, then these tiny things, this trauma, these tiny hemorrhages that occur and are controlled very fast, they would just occur. And if they occur in the brain, then there is a stroke. If they occur in the skin, there are bruisings. If they occur in the joint, there is joint pains, and so on. So thrombocytopenia is actually occurring because of the clotting, but the result is less clotting now. And now we have a bleeding disorder. First, we had a clotting disorder, and that caused its own issue. And now we have a bleeding disorder. Let's say when I was flapping or I was kind of smudging my skin over here, what happened was I broke this blood vessel. Let's say this blood vessel I broke. And when I have broken this blood vessel, what would happen is blood would start coming out, blue colored blood here. So sorry about that. So the blood would start coming out. When the blood would start coming out, we would start seeing some sort of a tiny bit of a hemorrhage. But before this becomes significant in a normal healthy person, platelets would come and just plug this area and done. And this blood will be picked up by macrophages and removed. So all good. But in some cases, when there are thrombocytes that are less, now we are able to bleed from these things and not control that bleeding fast enough. Similarly, here, when the thrombi are formed, the coagulation factors, the other chemical substances that take part in coagulation, they are also used up. So they are also not available in enough quantities to create the remaining part of the clot. Good. So now let's go back here. However, the vaccine may be associated with very rare case of blood clots associated with thrombocytopenia. So this word, this sentence and this sentence, if you combine them together, you would see the two ways of the messaging. And do I blame them? No, they are seeing both things. That is low levels of blood platelets, elements in the blood that help it to clot with or without bleeding, including rare cases of clots in the vessels draining blood from the brain. And they are saying that it is also possible that there are the blood vessels that are draining the brain, or sinuses we call them. There may be clotting in there as well. Now, what are they saying here then? The vaccine may be associated with very rare cases, or then the vaccine is not associated with an increase in the overall risk of blood clots. So here the difference in them is overall risk, and here may be associated. So when they say it is okay, what they're saying is, if I can try to sum them up, they're saying there may be some association with this. Vaccine may be causing it, but it's not sufficient to say stop vaccine. The risk is really, really low and rare. That's what they're saying. And then they're saying overall it is still better. This is why right in the beginning they said, hey, the COVID-19 itself can cause clotting and be fatal as well. This is why I had avoided this set of paragraphs to read them out yesterday, because it would have been a longer discussion then. So that is where it came from. Now let's continue. I read this and then I did not read this. So my request once again is that please read it. There is nothing that I'm hiding. It's not that this is my report in my, this is right in front of you over here. Look at this. I just find it difficult to just read them. But anyways, let me read this. The PRAC involved experts in blood disorders in its review. So they actually brought in neurologists, they brought in the hematologists, and they kind of involved them to see what is going on. So 11 million people's administration. Overall, the number of thromboembolic events reported after vaccination, both in studies before licensing and in reports after rollout of the vaccine campaign, 469 reports, 191 of them from the EEA, European Economic Areas, was lower than that expected in the general population. Now, hold this thought as well. What are they saying here? They are saying that the thromboembolic events in the vaccinated people is actually lower than what we would expect from the people. That means they're actually saying the vaccine may actually be healing. If I read between the lines here, I know that they don't mean to say that. But if they say that, hey, when you get a vaccine cohort has a lower incidence of a disease compared to general population, then I would say, well, that's a side benefit. Just like there are side effects, there is a side benefit. But I want to read one more statement down here. There have been very rare cases of unusual blood clots accompanied by low levels of blood platelets, components that help blood clot after vaccination. The reported cases were almost all in women under 55, but there is one more thing, and that is here. The number of reported events exceeds those expected. So either they're talking about some other event now, or if they're talking about the same event, then in the same one article from top to bottom, there are multiple positions that are taken. So here is information from the healthcare. Tell me I'm reading on the same page. The number of reported events exceeds those expected, and causality although not confirmed, cannot therefore be excluded. So those who are going to come out and bash me that somehow I'm against AstraZeneca, please realize that this is the wording on these. I am not against AstraZeneca. If for me the only vaccine given will be AstraZeneca, then I'll go take AstraZeneca. I will still take a vaccine over the infection. That is my position. I have never liked AstraZeneca because of its weird statements, but that doesn't mean I am against. If I'm given a choice, I would probably not take AstraZeneca. I have been open about it from ever. So people are just continuing to try to bash me to say, you got to agree that AstraZeneca is great. No, I don't need to agree that it is great. It is fine. But here are the messages. The number of reported events exceeds those. So now if I go back here, they are saying, in reports after rollout of vaccination campaign, 469 reports, 191 of them from EEA, was lower. Overall, the number of thromboembolic events reported after vaccination was lower than that expected in the general population. And here they're saying the number of reported events exceeds those expected. Now, I don't know what does that mean. If it is lower than the general population, then expected in whom? I have no idea. And causality, although not confirmed, cannot therefore be excluded. I can read it in one more way. They are saying to a healthcare professional that when you are thinking about it and when you are talking about it, don't put yourself at risk by saying, no, this is fine. At your narration, at your understanding, please realize the number of reported events exceeds those expected, and causality, although not confirmed, cannot therefore be excluded. However, given the rarity of the events and the difficulty of establishing baseline incidence, since COVID-19 itself is resulting in hospitalizations with thromboembolic complications, the strength of any association is uncertain. So there is a problem here in this statement. The problem is somebody who is vaccinated, they are not getting into a hospital with thromboembolism because of COVID. They are getting into a hospital for thromboembolism for either because of the vaccine, or if we say it is not the vaccine, vaccine is nothing to do with this, then for general other reasons. For people get thromboembolism for other reasons, those other reasons. But why to put it on COVID? Are we saying that those who become vaccinated are then getting COVID and then they are hospitalized and then they are having thromboembolism? Because of that, we cannot say, was it the COVID or was it the vaccine? That statement did not need to be here this way. Over here, they should have said what they said above. Compared to general expectation, our level of expectation should be low, equal, or high. That is the answer. This is not the answer. This statement is, what does this mean? Okay, so back here. I hope you realize where my confusion is coming from. Okay, so the committee experts looked in extreme detail at records of DSE and CVST. DSE is disseminated intravascular thrombosis, coagulation or clotting, and CVST is cerebrovascular sinus thrombosis, or the thrombosis in the head. Reported from member states, 9 of which resulted in death. Most of these occurred in people under 55, and the majority were women. They have an explanation for this as well down here. And that explanation is, the majority of reports involved women under 55, although some of this may reflect greater exposure of such individuals due to targeting of the particular populations of vaccine campaigns in different member states. So if I unfold their message here, maybe the healthcare professionals, maybe majority were nurses, maybe they were given the vaccine first, and maybe just because, again, vaccine didn't do anything, but because this group of women, I'm just unfolding that statement, I may be wrong here, women were nurses and they were given the vaccine first, so they became observed population. And maybe even if they did not have the vaccine, they would have gotten the same number of thromboembolisms. It's just that because we saw it in this group, they are saying maybe that is why we are seeing it under 55, because we selected that group. Are they right or not? They themselves do not know. So although some of this may reflect greater exposure, so how can I say with certainty yes or no? If I go along with them, I'll say they're saying because we selected this group. So back here. Where were we? Most of these occurred in 15 women. Because these events are rare and COVID-19 itself often causes blood clotting disorder in patients, it is difficult to estimate a background rate of these events in people who have not had the vaccine, which is fine. What they're saying is if you didn't have the vaccine, we don't know how many of the populations got it, and people in the population, and then if they had COVID or not. So I think that that number can be calculated, but anyways, they're saying we are not really clear. However, based on pre-COVID figures, so if you go before COVID, it was calculated that less than one reported case of DITC may have been expected by 16 March among those people under 50 within 14 days of receiving the vaccine. So they're saying if we go before COVID, there could be said that one report in general expectation should have arrived from this population that got vaccinated. So imagine if they were not vaccinated, then from that number, at least one report should have arrived. And they said, whereas 5 cases have been reported. I think if really we wanted to kind of put this comparison in front of people, what we should have said is this. We should have said, here is what we should have. If I was the one to show, this is what I'll do. I'll say pre-COVID, a group of, let's say we have vaccinated 30,000 people. So I'll say 30,000 women, same group before COVID, expectation is 1 case. I'm making up this number. I do not know the right number. Then in COVID time, and now they're saying it is difficult for us to really say what exactly is the number, but you can subtract these 2 numbers. So let's say here is the COVID time. And if you see 30,000 COVID patients, now can they actually have this age and gender and profession 30,000 observable? They may not have them. So that is why they are in trouble of providing this data. But I'll say in COVID time, the same 30,000 people, similar kind of people have, let's say, I'm making up a number here, please. Let's say 30 cases, because COVID also causes hypercoagulability, and these extra 29 are because of COVID. Then I would say, look, when you get vaccinated, and you are once again the same 30,000 people, same gender, same group, and you have 5 cases. And now I say there is 4 extra. This 4 extra is better than this 29 extra. And if there was no pandemic, this was the best. This is how I would have put it in front of us. Anyways, they're saying whereas 5 cases had been reported. Similarly, an average of 1.35 cases of CSVT might be expected among this group, whereas at the cutoff date, there were 12. So those who have been beating me up that I'm hiding the good news in here, there is a lot of confusion in here. I think the reason for this is they have to come clean. They have to tell you the numbers. Being an agency, they cannot hide the numbers. So they are putting the numbers out there, but now they have to kind of somehow present it as this as well, that, hey, look, it is not that bad. This is not as bad as this. And that is what they're articulating in some ways. That's what my understanding is. I may still be wrong. Okay, so then the committee was of the opinion that the vaccine's proven efficacy in preventing hospitalization and death from COVID-19 outweighs the extremely small likelihood of developing DIC or CSVT. However, in the light of its findings, patients should be aware of the remote possibility. So I'm going to now leave this, not because there is something else useful written here, because I feel you can read that. I want to read a couple of things that are important for patients and healthcare workers. One is, if you get AstraZeneca vaccine, what are the signs and symptoms that you should be aware of to see you may be getting bleeding disorder? And that is this. If you've taken the vaccine, if you're a woman under 55, but again, I think that woman under 55 is a red herring here, because they may have given it to the nurses and healthcare professionals who were women under 55 first. So it may not be necessary that it is a woman under 55, but if you are a woman under 55 and you have AstraZeneca and you get breathlessness, which means thromboembolic events in the lung, and you do not have enough oxygenation, or thromboembolic events somewhere else that is causing burden on the system to bring in more oxygen, and you're becoming breathless because body is getting deprived of oxygen. That is actually a very drastic thing. Pain in the chest or stomach, again, load on the system plus the maybe thromboembolic events in cardiovascular area or the GIT area. Swelling or coldness in leg, that would be that what is happening is that some, and this is very common in women in general, not just for the so let's say this is a woman's leg, and here normally what happens is women's legs usually have a greater propensity of developing blood clots. The reason or stagnation or swelling, the reason for that is that the blood, the veins that are taking the blood upwards, they have little valves in them, and blood almost goes up back from feet towards heart, almost like it is going in elevators. So what happens is a piece of blood that is here, this piece would come in here, and when it gets stuck here, what will happen is this valve behind it will close, and it would prevent it from falling. Then this blood under pressure will climb one more set of stairs and go one more step up, and the valve behind that will once again close as well. And this would just, blood would keep going up and up and up, finally back to heart. When the blood is going up like this, in these gaps, in these corners of these valves, it stagnates. It kind of sticks there and just sits there. That is a place where generally coagulation and clotting is possible. One, there is less oxygen there because blood is just sitting there for a long time. And secondly, this sitting blood tend to clot and coagulate as well. So women generally have a higher propensity of developing blood clots. So if you're a woman or a man as well, and if your leg starts swelling, that is an indicator that some sort of a clot has occurred, and now the blood is not able to go back up successfully, and blood is now accumulating in this area, and because of this, the leg has started to swell up. So that is the swelling or coldness. Coldness also is an indication that the circulation is not correct, and blood is warm. It brings in nutrition that makes the tissue warm. The cells warm, they take the nutrition, they use the ATP. In that process, they make heat. So if the tissue is becoming cold, that means it is getting less blood flow. Severe or worsening headache or blurred vision, that is thrombosis in the sinuses, plus blurred vision means either a damage to the retinal nerve or damage to the occipital area, so some problem in the brain. Then persistent bleeding. Again, we are talking about coagulation. Why do we have bleeding in coagulation? I just explained it, that there are, because of those extra thrombi and the use up of the platelets and the clotting factors, now we don't have enough of them. And so when more bleeding occurs, that would just bleed. multiple small bruises. So on the skin or other places, there may be more bruises. There may be petechial hemorrhages, small, tiny pinhead-like hemorrhages. And those, if I can, without violating somebody's, what is that? Copyright. If I say petechial hemorrhage, see those tiny spots. So again, there may be a copyright thing, so I'm going to go back from here. So petechial hemorrhages, and then purplish spots, which is also a sign of bruising. Blood would come in and break down and become purple in color, or blood blisters into the skin. So all of those are signs that there may be bleeding going on, and you got to talk with them. And for the healthcare professional, here are your understanding. Cases of thrombosis and thrombocytopenia, some present as mesenteric vein, so the mesenteric vein or cerebral venous thrombosis have been reported in persons who had recently received COVID-19 vaccine. AstraZeneca mostly occurring within 14 days after vaccination. The majority of reports involve women under 55, although some of this may reflect greater exposure. So we talked about it. The number of reported events exceeds those expected. They said above that it is below what is expected. And causality, although not confirmed, cannot be excluded. So they're saying I think what they're saying to healthcare workers is, don't go out and say, no, it will not happen because of this. Here they're saying, remember, there could be causality and we cannot exclude it. However, given the rarity of the event and the difficulty of establishing, we read that. Emma considers that the benefit-risk balance of the medicine remains positive and there is no association with thrombotic disorders overall. So again, the word here is overall. Because if you remove the word overall, then you can't say there is no association. They just showed the data above. However, steps will be taken to update the SMPC and packaged leaflet with information on cases of DAC and CSVT. Healthcare professionals are urged to be alert to possible causes of thromboembolism and DAC, cases of thromboembolism and DAC. So what is a healthcare worker to see in the patient? Here, easy bruising. If the patient says, hey, I've started bruising easily, or I started developing these purplish bruises on my hands or legs, or my legs are swelling, or my leg feel cold, or I have headache. So easy bruising, bleeding, persistent or severe headache, particularly beyond 3 days after vaccination. So this is where I want to stop. I want to go back to the Dr. Bean things as well, but I wanted to make sure that we have this scene, because somehow those who like AstraZeneca was blaming me that I'm hiding the good news, and those who don't like AstraZeneca were blaming me that somehow I'm not presenting the bad news. So that is just, I can't win. And it is funny that some people are generally mean as well. So they were then saying, you see, this is why you're behind others. You just do not do the right things. So fine, whatever. Here, I'll take a couple of questions and we stop, and then we'll continue. My question to you, once again, for Europe and Asia, if you don't give me feedback, I'll stop after this week. So I need your feedback to see if it is successful, if it is something that is useful or not. And the feedback is, what is the best time? What are the kind of topics you would like? My thinking is 3 days COVID, 3 days non-COVID discussions, diabetes, aging, hypertension, cardiovascular, others. Or maybe 3 days chit chats and then 3 days other topics. Or maybe a different number. So please give me that data. Let me look at some of the questions. Nick says, why did they not compare incidence of clots between AstraZeneca and that is what is a very important point. I think it was not their job to do that kind of comparison. They're not a data presenting company. They were to do the research. Ideally, someone has to, and Nick, it seems like we have to. Someone has to pick up all of these vaccines and say, here are their side effects. Here is their hospitalization data. Here is their death data. Here is how AstraZeneca does versus Pfizer does versus Moderna versus XYZ. I think we may have to, and I think it has to be a living document because it would change. So maybe I should put together a page on Dr. Bean where we start capturing this data and start comparing them. Because this is important to put this in perspective scenes. So very good point. Nick has one more question here. Have they identified this as a subgroup associated with these clots? If I were in such a group, I would like to know. In such a case, overall, this is absolutely very, very important. So I think you're raising all the right questions. I don't have the answers to them, neither did they provide those answers. Ideally, I want to know, what is this subgroup? Am I, being a nurse, female nurse, working somewhere in a hospital, getting vaccinated, am I at a higher risk because of that? Or do I have some meaning? If I know it, then I can at least decide that maybe I'm young enough to not get severe with COVID, and maybe I can skip this vaccine and go for another vaccine or wait for another vaccine. So I don't know. You're correct here once again, and that data is not present. Mark says, can you upload a video? Yes. So Mark, I think what we'll have to do is the following. First, we have to put together a page to collect the data. Then we can do a video, because if I do a video, let's say 4 days ago, then the data was different and today is data different. So first, let's put together a page. And I actually need Cool Beans' help with that. It's me who does all of this. So I would request someone from the Cool Beans as well to rise up and help me collect and curate that data. Okay, so the sales trainer says, your comments teaching is invaluable. Thank you for your knowledge and time you're giving us. Devoting present information, need to ask that question. Truly appreciate it. Thank you very much. I am sure that there are going to be some more comments that I'm hiding something, but please, guys, I'm not hiding anything. There is a link in the description for this, or you can just simply Google EMA for AstraZeneca. And you can read it the way you like. You can read it all you like. Why do I have to pick up something public and hide it? So Maru Andriani Senior says, hello from UK. Finally, since yesterday, we can chat with you, Dr. Mubin. We all love you and your lectures. Thank you, your family as well, for giving us the time and have this morning show. You are very welcome. Please do tell me that what is the good time. For example, I used to have a meeting at 10 with my tech team. So today they are still waiting. They must be wondering, where am I? So I need to understand what is a good time so that I can readjust my schedule. But you're most welcome. And I also want to understand if it is valuable. If I'm just sitting here blabbering and saying things that may not be of value, then I shouldn't do it. Maruk says, most of the 60 above population is on antiplatelets. Is this why AstraZeneca is safe for elderly? Maybe. Again, there is no data to say that. Look, the message here says it is not AstraZeneca. So when it is not AstraZeneca, then all other thrombosis-related AstraZeneca questions become irrelevant. But if you see their paper, this article, you can see that they say it is not it, and then they say it is it. Then they say the event incidence is not higher. Actually, they're saying it is lesser. Then they're saying it is higher than expected. So this page has all messages. If you sue them, from this page, they can find all kind of messages back to you to say, we said this, we said this. So Phil Lee, overall, the risk of thrombotic events is lowered, but that particular type known to be raised by the contraceptive pill is raised in women in childbearing age. Coincidence? No, so Phil, that is actually incorrect, that overall event is lowered. So let me, after such a long discussion, let me say it once more. Look at this. If I just go with them here, yes, they are taking their wording. You're taking their wording and saying it perfect, fine. Look at this. They are saying the vaccine is not associated with an increase in the overall risk of blood clots. Good. Blood clots is what they use, thromboembolic events. Good. Now they're saying may be associated with very rare case of blood clots associated with thrombocytopenia. Do you know that the thromboembolic events are usually associated with thrombocytopenia? Once the thrombi are formed, once the thrombi are formed and they consume the clotting factors and the platelets, then the result is thrombocytopenia. It's just the intensity. So let's say if I just have two thrombi formed, then I won't get thrombocytopenia. But if I have DIC, a lot of thrombi are forming in my blood, then I would get thrombocytopenia. So these two are really not two separate things, unless we're talking about the intensity. And here just two cases, two thrombi in a person, and here bleeding as well. Then, so hold this thought here that they're saying vaccine may be so there is increase. Then hold that thought and come here. This allows Park to confirm that there is no increase in overall risk of the blood clots. Then they're actually saying here, look at this. Overall, the number of thromboembolic events was lower than that expected in general population, was lower. And then if you go down here, when they're talking with the healthcare workers, they're saying the number of reported events exceeded those expected. And causality, although not confirmed, cannot therefore be excluded. You know what is going to happen is that people who are going to pick up these messages, they're going to say, well, they were talking about thromboembolism here and thrombocytopenia here, and they are actually the same one thing. It's the intensity that is different. And Phil, your message that maybe it is something related to the contraceptives. So you're saying that maybe women are getting it because contraceptive. If that is the case, see, this is why these double speaks are present in these articles. If that is the case, then why is this way? Look at this. They're saying, based on pre-COVID figures, it was calculated that less than one reported case of DSE might have been expected by 16 March among people under 50 within 14 days of receiving the vaccine. So that group, based on previous COVID, one person, they're saying, whereas 5 cases been reported. We can still stand up and say, not related. Nobody's going to stop them from saying it, but they're showing the data here. You can never blame them from hiding anything, because the data is here. Then, similarly, on average, 1.35 cases of CSVT may be expected among the age group, whereas by the same cutoff date, there were 12. Now, is that contraceptives as well? Yeah, so this is, I just addressed it, Phil. It looks like you are on this side of saying we should admit that it is lower. Believe me, if you take this direct quote that I just showed, the opposite of that in the same article, if we take this direct quote, do you know what they're saying? They're saying giving this vaccine lowers thrombosis. Okay. So Chuck Becker is saying, Dr. Bean is making a huge and very shrewd, savvy point. Chuck, isn't it written that way? You tell me, am I misreading it? Or hormones associated with premenopause? Agreed. But again, if you look at it, the data before COVID and before vaccine says one person should have it. That one person in the same age group within the same window of time would have all the same risks that the person who got vaccinated would have. Same menopausal issues, same times, same hormone replacements. But they had a chance of one. Here, the one who became vaccinated, are they going to go and then take hormone replacements or more? They're 5. Or instead of 1.35, they're 12 for cerebral thrombosis. So there is something in there. I cannot justify it one way or the other. I cannot, if you ask me that, hey, Mubin, you sit here and say AstraZeneca is great and this thrombosis does not occur, I cannot, even they are not able to say it. And if you sit here and say, Mubin, you should say AstraZeneca is bad, I cannot, because over here the message is in both ways. So and this is, look, Sai says there have been clotting issues with Pfizer as well. Also, can a person mix doses? That is, I don't know about the doses, but please realize this thing. This used to happen when I was working in engineering, that some engineers would come and say, you are asking me to protect this server. That server is not protected. And I was saying that an example of an incorrect thing should not justify the other incorrect thing. Same here. If Pfizer also has it, does that mean we should then ignore it? That it is okay? We should see what else is out there. Pfizer has it, Moderna has it, Johnson & Johnson, Novavax, whatever has it. We should at least know that instead of dismissing it. I don't find this to be a decent dismissal argument to say, because Pfizer has it, AstraZeneca has it, this is okay. Phil, you are actually incorrect. So I'll have to show it to you again. I don't know why you're not able to see what I'm seeing. So let's see. You are saying that the only one that are raised are CSVT, CVST, which is serious enough as well. There are deaths as well. But look at this. Why don't you see this? Read this with me. However, based on pre-COVID figures, it was calculated that then less than one reported cases of DIC might have been expected by 16 March among the people under 50 within 14 days of receiving the vaccine, whereas 5 cases had been reported. What percentage difference is that? And you don't consider that to be a difference? Here they're saying 1.35 was expected and 12. Actually, the percentage difference is very similar. This is lesser than 1 to 5. This is 1.35 to 5. So again, I'm not sitting here to argue. Totally up to everyone to see what they are. What is that written there? I am just showing here that there is a confusion in these talking points. And I think this is exactly what is happening, that if you like AstraZeneca, you can take away from here and say AstraZeneca is awesome. If you don't like AstraZeneca, you can bring here and go here and find things and say, well, it is concerning. And I'm not going to sit here and make it awesome for you or concerning for you. I'm just going to present it. Okay, so with this, I'm going to stop. Thank you very much for watching. Please like, subscribe, and share. And there are 3 links in this description. One is to buy me coffee. Another one is to be my patron. And the third one is to support this work in general. We would see each other. Please tell me if the time is good, if the topic, how should we structure them, and so on. Talk to you later. Bye-bye.